All right, so now we're going to break out the cervical spine. We're going to combine the flexion, extension, rotation all together when we break it out. Okay, but I want a quick review in case you forget what Katie looked at when we did the top tier. Okay, so her flexion, go ahead and put your chin to your chest. Again, she was about inch and a half shy of her chest. So right there, boom, dysfunctional. If you do it again, you see flat here, kind of a CT junction hump here. And so we have this non-uniform spine as well. So she's dysfunctional, not painful. Extension, go ahead and go back all the way. You see, she's here, right? But again, she does kind of dump up here. But I'm guessing when we do the breakout, she's going to be able to get that 10 degree, she does here. All right, but we'll still do it. Okay, but she passes that 10 degree mark. Rotation, if you go mid-clavicle, you see how her nose does not get to the vertical line and she wants to extend. All right? So she's dysfunctional, non-painful, and 2 out of the 3, most likely her extension as well. But we're going to break that out. All right? So we're going to start with flexion. So the first rule, right, you're going to remove the large segments. With this, we're just dealing with the spine, cervical spine. So there's not going to be this huge segment we're removing. So we're going to kind of skip that logic step. There's nothing to do. And then we're going to remove the instability requirements. So how are we going to do that? We're going to lie her down. Okay, so I'm going to have you go ahead and lie down on your back. So remove all these stability requirements, right? And then we're going to move to her actively doing it. Okay, so I'm going to have you, because this should be more difficult. She should have more difficulty doing this. If she comes up actively and she touches her chin to her chest, then that's a stability motor control issue standing. So she must have these muscles firing artificially, stabilizing when they shouldn't be. But most of the time, 99% of the time, they can't do it standing. They're not going to be able to do it supine because you're going against gravity. But let's see what she can do. So Katie, can you go ahead and just bring your chin up to your chest? Again, distance even increases, right, which is pretty common. And then come on back down. So she couldn't do it actively. Okay, so now what's the next step? Now we're going to do passively, right? So I'm going to take her head up and see if I can touch her chin to her chest. So I'm going to go up. Relax for me. And I'm just going to gently just come up. Don't try to break her head and neck, right? You're just going to feel for that first bit of tension, and there it is right there. Still quite a bit of distance between that chin and chest, right? If I could go up, and then it went smoothly and touched your chest, well then that would be an active cervical flexion stability motor control issue, okay? Non-mobility dysfunction, all right? But the fact that we go here, and she's stuck, now I can say, okay, there's a mobility dysfunction there. Now where the heck is it coming from? Is it her lower cervical spine, upper cervical spine, or is it her OA joint, which has a minimum of 20 degrees of flexion comes from the OA joint, right? And so in order to determine that, we have a special test we do. They were doing it for quite a few years, and it's called the rotational flexion test, right? And so what I'm going to do is I'm going to take her cervical spine, I'm going to rotate it passively, right? Relax for me. I'm just going to rotate as far as I can here, okay? And then I'm going to have her then actively, because when I rotate it, I'm locking up her lower cervical spine, so it's not moving. So I'm going to rotate her here, and then I'm going to go ahead and have her tuck her chin down and come back up. And so that's not 20 degrees. Do it again for me. Okay, come back up. And you see how her whole head is going like this? All I want is a nodding. Okay, so go ahead and do it one more time. Yeah, come back up. And so it looks like her mouth chin is trying to drop a little bit too. So I'd say that's not 20 degrees. We could try the other direction. I'm going to go ahead and rotate. Okay, and then actually, so this way. Remember in the beginning when her left was easier to rotate than the right? Right? That's what we said, right? You know what we said when you were standing? Yeah. And so even me rotating, less restriction. And I'll go ahead and tuck that chin. Still probably not 20 degrees. One more time. Okay. And so I'd say she has some, so if she can't do that 20 degrees, it's not a part of the SFMA, but I could passively do it if you follow their logic steps, right? And see if I can get it. Still feels kind of restricted right there. Right? So I'd say it's probably still not 20 degrees, but that would be a mobility dysfunction of her OA joint, okay, if you follow the logic steps. Right? So that's the breakout. Now if you did that and she got 20, 30 degrees, fine, okay, then you'd be thinking then it's more of a mid to lower cervical issue going on, not the OA joint. Right? So that's cervical flexion breakout. Extension, I'm going to have you slide all the way back. Now remember, she got to that 10-degree mark right there. You want her shoulders off, but you don't want it too far off that she tenses up. So remember before, she hit that 10-degree mark, but her spine kind of was dumping, right, up at the upper cervical. So I'm guessing when I do this, we'll get it 10 degrees. So all you do is you take the head back as far as you can go. And again, you're looking at this angle here. This is 90. You want to be at least 10 degrees shy of that. Okay, she gets that. Come on back up. Any pain with that? So this is the easiest breakout of them all, right? So you're just going to take your head down, looking for that 10-degree mark. If you couldn't get it for some reason in this position, you know, that could possibly be a mobility issue. I'd probably still with her look at her mid to lower spine, and then we already saw her OA, so we'll look at her AA joint later. But so she'd pass this. She got beyond that 10-degree mark. Rotation. Okay, can you scooch back on the table? So with rotation, she was dysfunctional on both sides. Okay, so the first thing we're going to do is move the large body parts. Again, cervical spine doesn't work with that, so we skip that step. Now we're going to remove all the instabilities, right? So we're going to lie her down, all the other muscles should shut off, and in this position I'm going to have her go ahead and we're going to find that mid-clavicle. Right about here, and then we're going to have her go ahead, keep your head nice and straight, and rotate. And again, even with this, she likes to move that into extension. So I'm going to help kind of guide her. Go ahead and rotate for me. Right, looks like she's still a little restricted there. Do it again for me. So she doesn't quite get to that finger mark. So she still doesn't quite get to 80 degrees. Okay, now try the other direction. And that's close. I don't know if you can see that on the camera. So go ahead and just keep the head nice straight, and I'll go ahead and rotate. So that is, she gets there with that one, right? So this is a good example on one side. Okay, so I can do it passively now, right? After you actively do it passive, and I go passive, relax for me. And right there I start to feel restriction. So I don't get to that 80-degree mark. This side, you can see the difference. I don't feel restriction, so right there. So she's past 80 degrees. So with her then, right, she would have a right mobility dysfunction and a left stability motor control cervical rotation dysfunction. Because she can actively do it here, but she struggled somewhat standing, then I can passively get it there. Right? So now since she has mobility dysfunction on this side, we want to determine is that coming from the AA joint, the upper cervical, or the lower cervical spine. Right? And so 50% of our rotation comes from our AA joint, so 40 degrees worth. So how we test that is we're going to flex the spine to lock up the lower cervical, and then we're going to have her actually rotate the spine, okay, and see if we get that 40 degrees, right? So this, when we get her head up, this is going to be 0, right? This is going to be 90, so we want to get kind of midway between that. And I kind of eyeball shoulder here, and I kind of eyeball where in her armpit area that 40 degrees would be, right? So what we can do then is I'm going to passively bring her head up until I feel that restriction. And then we'll go to the left first, because I'm guessing hopefully the left will be fine. Okay, we're going to flex her up, and then I'm going to have you rotate to the left. You can see she goes way out, well beyond 40 degrees. I don't know if you guys can see that or not. And then come on back, and then do it again. And if we remember right, that left rotation was a stability motor control issue. All right, so she passed that 40 degrees. Now let's see what her right does. Go ahead and rotate to the right. A little more restricted. Okay, do it again. Right about there again. So this is going to be more so here, right? And this seam of the shirt. Come on back. So this is 0. This is 90. Do it again for me. I don't think she gets there. Let's go to the left again. And you see this gets over here. So you can tell there's a difference, a significant difference between left and right rotation. The other one was over here. This was here. And so this, I would say, since she didn't get that 40 degrees, I would say that this is going to be a mobility dysfunction of her AA joint to the right. A stability motor control of left rotation. All right? So then which one do we treat first? You treat the mobility dysfunction. And that's the breakout for the cervical flexion extension rotation.